Imagine working in a hospital where every day feels like a balancing act. You're caring for patients, juggling deadlines, and the stakes are really sky high. Now ask yourself, how much do you trust the people running the place? Those are the ones who are setting the policies, approving budgets, deciding how many staff and colleagues you'll have. That single question, do you trust your leaders, might tell us more about the health of our hospitals than any other performance metric ever could. After years of focusing on how patients trust doctors, researchers have begun to wonder a bit more about the other direction. How much do doctors, nurses, and other healthcare workers trust their leadership? A research team in the article that I cite down below surveyed over 350 healthcare workers from across the US, asking not just how much they trusted leadership, but also why, and what that difference that trust made to their work. Now, this survey wasn't just a tick box form. Participants wrote openly about their workplaces, their frustrations, their moments of pride. Researchers coded these answers by theme, so how trust shaped job satisfaction, motivation, even care quality. Now, the numbers in the research I think really speak volumes. About 1 in 5 healthcare workers said they trusted their leaders very much. Over 40% had little or no trust, but 98% said that their level of trust actually affected their professional life. And I think those numbers are a little bit concerning. It feels like quite a lot of workers don't trust their leaders very much, but 98% think that their level of trust really impacts their professional life. And that feels like a strong pull to the negative. It's not all one-way traffic though. When trust was strong, workers felt real satisfaction. They took pride in their organisation and they produced higher quality work. Fantastic. They described focusing on patient care instead of office politics, and they felt safe to raise concerns. They even worked harder because they wanted to. Now yes, when trust was weak, that story flipped. Dissatisfaction went up, staff disengaged, and indeed some left altogether. People talked much more about exhaustion, resentment, and what one participant called the bare minimum day. And of course, all that means that ultimately patients will get better care when trust levels are higher. So what actually earns that trust? After all, this is Trust Me, I'm a Philosopher, where we learn about trust, what it is, why it matters, and how to build it. So what builds it? Well, in this study, they found 3 core ingredients. The first is to communicate effectively. So be transparent, accessible, and follow through on what you say. Secondly, treat workers well. Show respect, fairness, and appreciation. And third, in this case, prioritise patient care. Focus on the care, not the cash flow. How was the trust lost? Well, the opposite, really. Silence, disrespect, and what was seen to be profit-first decision-making. And perhaps most damaging of all, a lack of integrity. Workers felt they could tell when leadership's words didn't match their action. Now, if you're a cynical sort, that you might expect that 1 and 2 would have happened naturally. You might think that people want to be communicated with clearly, and you might naturally think that healthcare workers want to be treated well. That's a bit of a cynical take, but I guess perhaps you just might think that that's how this is going to play out. Frankly, who doesn't want to be communicated with clearly and who doesn't want to be treated well? But the prioritisation of patient care as an important driver of trust should give you pause if you're inclined to that kind of cynicism. Because this seems to be appealing to something else. This doesn't seem to just be healthcare workers thinking about what's in their own interest. This seems to be something, I guess, altogether different. But I think if we appeal to the philosophy of trust, we can actually use that to understand what's going on. A decent number of philosophers of trust, including me, treat trust as something like reliance plus. So that's reliance plus some other feature. So, to trust someone to do something is to rely upon them to do it, and then to have some moral dimension of the relationship thrown in as well. So to give you an example, if I trust my wife to save me a glass of wine, then I'm relying on her to do it, but I'm also expecting that she ought to, in a moral sense. To the extent that if she doesn't do it, then I'm going to feel betrayed. I'm going to feel that she's betrayed my trust in not saving me the glass of wine. That's obviously a trivial example, but we can play it out when we start to think about trust in the healthcare circumstances. If I'm someone who's working in healthcare, I think it's a good bet that one of the things that matters to me, morally, ethically, is the care of my patients. So if you behave in a way that aligns with my values on that score, then you're showing the same values as me. And in that case, I'm surely more likely to trust you and not just rely on you in some future case. To be really blunt about it, if I'm someone who cares very much about patient care and then you demonstrate the same, well, then your values align with mine. And if trust is reliance plus this moral value stuff, well, now I'm just more likely to trust you. So I think this gives us a nice insight into how this philosophical idea about trust as reliance plus something that gives us this normative dimension can really help us to understand what's going on in a case of trust appearing in the wild. And I think it's really easy to see how you can use that. If you manage a team, in healthcare or anywhere else, remember that trust isn't something that you can just order. You can't just go and buy it on Amazon. Trust is built piece by piece, and it's done through your choices. So ask for feedback, share what you know, do all of that transparent communication stuff that we were talking about. Also match your actions to your promises. But then crucially, and this is what we were seeing there in the third claim about what builds trust in the healthcare setting, make sure that you align your actions and your values with those of the people who you are working with. After all, as we said, where you get that kind of alignment in value, you're so much more likely to be able to build trust. So communicate effectively, treat the people who are working for you well, and make sure you try and get that kind of value alignment. Do those three things, and it certainly looks like from this research that you'll be driving trust in your organisation. And on the subject of transparent communication and asking for feedback, if you enjoyed this, then give the video a like and subscribe to the channel for more tips on how to build trust. Until next time, stay suitably trusting.